7:10. Dr. Rachel Clark is an NHS palliative care doctor. Her book is called Breathtaking, an account of working on COVID wards during the first wave. Thank you for coming on the programme, Dr. Clark. You heard the thoughts of Mark Harper. He's had that view for some time, I think it's fair to say. I wonder what you make of Rishi Sunak saying that the scientists were given too much power. Morning.
Hi. Well, one of the most important things that we do in science and medicine and ideally any enterprise that's evidence-based, including politics, is to reassess all our decisions and our actions according to new evidence. So it's really appropriate with the learning and the evidence and the information we have now to be looking back over the events of the 2 years of the pandemic and thinking, have we done the right thing or not? Did we make mistakes? That's good scientific practice. That's a brilliant thing to do. And nobody would pretend that the way we handled the pandemic was perfect. It was inevitably going to be imperfect because this is the real world. Mm-hmm. But sadly, that's not what Rishi Sunak is doing here, is it? He's suddenly had this Damascene conversion to honesty when he's trailing Liz Truss in the polls and he's pandering to his Conservative Party base because he's desperate to be Prime Minister. He's saying what he thinks people want to hear.
But it might also be true.
What he's saying what he's saying is nonsense. The second lockdown that Mark Harper just referred to is a perfect example. So we're talking last January after the Christmas where famously we were allowed to mingle with each other. Those 4 to 8 weeks, were the worst weeks of my professional career because everywhere, up and down the NHS, even with lockdown, people were dying because we didn't have enough ventilators, enough beds, enough staff. People were dying before our eyes. They were so desperate at home, they were calling paramedics, being told it will be hours for an ambulance, booking an Uber desperately to try and get them to hospital and arriving dead in the back of the Uber outside London hospitals. That's how bad things were with lockdown. And patients who didn't have COVID at that time were also dying because we were overwhelmed. So to now pretend that was bad practice and that lockdown was unnecessary is absolute nonsense.
To be fair, I'm not sure he's saying that the lockdowns were unnecessary, but there needed to be more honesty about the trade-offs involved in having those lockdowns and less of an emphasis, as Rishi Sunak sees it, of making the public scared into believing that the only decision that could be taken was to implement a lockdown, which has come with enormous costs financially and actually emotionally and health-wise to a lot of people.
Yes, absolutely. And I think, as a doctor, I don't think using fear as a tactic to try and persuade people to do anything is a good idea. So I'm certainly not going to try and defend.
Do you think there was some overblowing of the impacts that COVID could have on people?
I think I don't think anything was overstated about those impacts. And actually, I think there's a lot of rewriting of history going on here. If you think back to Chris Whitty and Patrick Vallance and the way they spoke in those daily press conferences, they were sober, they were responsible, and they were honest about the trade-offs. They were saying, this is bad, we don't want this to happen, this is a necessary evil. No one was ever a champion or a cheerleader for lockdowns. They were awful for us all. None of us wanted our kids not to be in school, but nor did we want to have to tell kids that they're now orphaned because both their parents have died of COVID, which is something we've had to do in my hospital, in every hospital. So there were necessary evils going on here. And it may be that Boris Johnson chose to be crude in how he communicated with the public. And I think that's undeniably the case. But actually, the scientists weren't like that. Chris Whitty was an outstanding communicator in many ways through the pandemic. And I think this is a deliberate attempt to recharacterize the past to make political points now that serve someone who wants to be Prime Minister.
Good to speak to you. Dr. Rachel Clark, you're an NHS palliative care doctor. Your book is called Breathtaking, an account of working on COVID wards during the first wave of the pandemic.